Good morning. Convening our Committee on Health and Homelessness hearing for Wednesday, March 15th, 2023, 8:30 a.m. here in Conference Room 329. Welcome to everyone who are here. As we've done in the past, the practice of this committee is to have hearings and then to defer our decision making until 11:30 a.m. So we will be following that process. Also, for those who are participating via Zoom, welcome. If we lose you because of some technical difficulties, we may have to stop the proceedings, but we will also proceed along as expeditiously as possible. So on that note, we're going to start first with Senate Bill 64, SD1, relating to Medicare supplement insurance. First up, in opposition, Insurance Division. Commissioner?
Good morning, Chair, Vice Chair. Gordon, you're testifying on behalf of DCCA. We oppose this bill. The bill would require insurers offering Medigap policy to have an open enrollment period. With open enrollment, it would cause instability with that pool and may result in premium increases on the Medigap policies. I'll be glad to answer any questions.
Thank you, Commissioner. Mr. Adam Zarin, Leukemia and Lymphoma Society, in support. Okay, Dr. Bernard Robinson, Hawaii Medical Association, in support. Barbara Penn, Punakaukas Democratic Party. Ms. Diesman, HMSA.
Good morning, Chair, Vice Chair. Thank you for the opportunity. HMSA has strong concerns with this measure. We actually think it should be deferred. It will destabilize the market relative to Medicare products as well as for Medicare products by having open enrollment year-round. Thank you.
Thank you. Hawaii Association of Health Plans, in opposition. Nash Witten Individual, in support. And Ken Farm, in support, individual. We also have in support American Kidney Fund. Okay, questions, members? I have a question for Commissioner. Okay, after further study of this and looking at the testimony from Mr. Zarin, it appears that other states have implemented some kind of provisions for this kind of protection for Medigap policies, Connecticut, Massachusetts, Maine, and New York. Can you comment on what their policies are?
I know that those states do have open enrollment, and I also like to note with the states that do have open enrollment, the top 10 states that have the highest Medigap premiums are those that have open enrollment. So that's part of our concerns in terms of creating instability in the ability for insurers to price the product.
Okay, I understand those concerns. In those states, do they have guardrails on the enrollment process so that, because I understand the concern could be Medigap insurance shopping. So like someone gets sick or something and then they want to go look for another Medigap policy, that would be the problem. Is there any safeguards that would like just tell them once you've picked a plan, you got to stick with it for 12 months or 24 months?
Yeah, I understand your question, Representative. I don't have the answer right now, but we can provide it to you.
Okay, I think that's important. I think it's an interesting conundrum presented by us. So it's something that I think we need to continue to look at.
Okay, thank you.
Thank you. Seeing no other questions, next up, Senate Bill 63. This is relating to nurses. We have comments from the Board of Nursing.
Good morning, Chair, Vice Chair, and members of the committee. My name is Chelsea Fukunaga. I'm the Executive Officer for the Board of Nursing. The board offers comments and will stand on its written testimony. Thank you.
Thank you. Comments from RICO, Regulated Industries Complaints Office, Esther Brown.
Good morning, Chair, Vice Chair. I'm Esther Brown, Complaints and Enforcement Officer for RICO. I'll be standing on my written testimony offering comments. And in sum, my testimony is that from an enforcement perspective, this is a good bill. Thank you.
Thank you very much. We have testimony from Hawaii State Center for Nursing in support.
Good morning, Chair, Vice Chair. My name is Laura Reichart. I'm the director of the Hawaii State Center for Nursing. Thank you for having the opportunity to provide my testimony in support. I want to reiterate what Rico said. We also feel like this is a good bill. This would be very important for recruitment of nurses. One of the challenges with recruitment is the length of time for licensing, which causes nurses to forego the jobs they've secured here and confirm jobs elsewhere. And so it would decrease the work effort with recruitment. It's very important. When we have asked our nursing colleagues and community, one thing that they wanted to really emphasize is having some kind of assurance that temporary licenses will be issued in an expedited manner, and they've proposed a 7-day time frame to the Center for Nursing, which we have submitted herein. I also want to clarify that in the section related to exemptions, we also confirmed with 5 hospitals across 3 counties that they are they are hiring nurses as graduate nurses, which is someone who is not yet licensed. They're working on their licensure. They've just graduated, but it enables them to start onboarding them and training them before they're doing their nursing duties. And that provision, so what we have done is proposed updates to that statute, and we're also asking that it remains in the statute. Related to DCCA's testimony on Section 1, we had proposed our differences, or that we had proposed for that language to be embedded into the registered nurse and licensed practical nurse sections, to be an additional description on how one can become licensed. But functionally, what we would be asking for is that the tasks and functions, the criteria that they've identified is the same.
Okay.
Yeah.
Okay. Thank you. In support, Mike Robinson, Hawaii Pacific Health.
We'll stand in our testimony in support.
Testimony in support, Queens Health System, J.C. Mikulinik.
Chair will stand in our testimony in strong support. Thank you.
Thank you. Testimony in support, Eric Abe, Hawaii Primary Care Association. Testimony in support, Paige Heckathorn Choi, Hawaii Healthcare Association of Hawaii. Support, Barbara Penn, Kupuna Caucus, Democratic Party of Hawaii. Testimony in support, Hawaii Association of Health Plans. Testimony comments, Grassroots Institute of Hawaii, Ted Kafalas.
Good morning, Chair, Vice Chair. My name is Jonathan Helton. I'm standing in for Ted Kafalas, and I just wanted to say that we'll be standing on our written testimony. Happy to answer any questions that I can. Thank you.
Thank you. Dr. Marian Senti, individual in support. Any testifiers via Zoom? Yes? No. Any testifiers in the room? Any late testimony? Seeing none. Members, any questions? Go ahead.
Sorry. Question for the Board of Nursing, I guess. Hi, thanks. Sorry, I just have a quick question. In your testimony about separating the application for the temporary and the permanent license simultaneously, is the reasoning for that because you guys do different checks for both of those, or
That's correct. So I guess the processes are a little different, so it would involve different processes basically. Yeah.
Okay, but is the information they're submitting the same?
Not for the I guess the way the bill is written currently, it would be very similar, but our proposed would be different. Our proposed HD1.
Okay, so but if the bill were to were more in line with the requirements for the permanent licensure, it would be okay to have one application form to
it would be
submit simultaneously.
That's correct.
Okay, just to try and streamline things as much as we can. Okay, thank you.
Anything else? Wonderful. Moving on to Senate Bill 320 relating to psychology interjurisdictional compact. We have testimony in support from the U.S. Department of Defense, Military, Community, and Family Policy, Kelly May Douglas. On Zoom?
Good morning. Good morning, Chair Belatti, Vice Chair Takanuchi, and members of the committee. I will stand on our written testimony. Thank you.
Thank you, Ms. Douglas. Testimony comments, Board of Psychology, Christopher Fernandez.
Good morning, Chair, Vice Chair. This is Christopher Fernandez. On behalf of the Board of Psychology, I'm here to stand on their testimony, appreciating the intent of this bill and offering comments.
Thank you, Mr. Fernandez. Aloha Care in support? Thank you. Hawaii Association of Health Plans in support. Comments? Grassroots Institute of Hawaii?
We'll stand on written testimony.
Okay. Comments? Alex Lichten, Hawaii Psychological Association. Opposition? Noelani Rodriguez, an individual. Any other testifiers in Zoom? We have lay testimony in support from Diana Bray. Any other testifiers in the room? Seeing no other late testimony, members, questions? I had a question for Grassroots Institute, please.
Yes, Chair.
Actually, I'm going to pass. I will call you up on the next one. Thank you. Members, seeing no other questions, moving to Senate Bill 668. This is our physical therapy compact. First up in support, Ms. Douglas from U.S. Department of Defense, Military, Community, and Family Policy. If you're still on Zoom.
Thank you, Chair. Thank you, Chair Belatti, Vice Chair, and members of the committee. Kelly Mae Douglas with the U.S. Department of Defense in support of this bill. The Department of Defense is very appreciative of Hawaii's ongoing commitment and efforts to support members of the military and their families who sacrifice so much in support of their country. This bill would allow Hawaii to continue to support the employment and financial security for military families. Thank you.
Thank you so much. Comments? RICO, Regulated Industries Complaints Office, Esther Brown. Thank you. Comments? Department of Commerce and Consumer Affairs, Alania Gogi. Oh, I'm sorry. Comments?
Yes, I will stand on our written comments, just indicating that this is an unfunded mandate if we were to implement it. Thank you.
Thank you. Jeff Rosa, testimony in support, Physical Therapy Compact Commission. Online, on Zoom? Nope. Okay. Comments? Grassroots Institute of Hawaii.
We'll stand on written testimony.
Thank you. Comments? Evan Oy, Hawaii Association for Justice.
Aloha Chair, Vice Chair, members of the committee, Evan Oy on behalf of the Hawaii Association for Justice. We understand the intent of this measure. However, we do want to note our concerns with the immunity provision in G1 of this bill. It is overly broad, and we do raise concerns for Hawaii residents in that ability to recover in those instances. So, available for any questions. Thank you.
Thank you. We have testimony in support from Dr. Marian Senti, individual. We have lay testimony from APTA Hawaii in support. Any other testifiers via Zoom? Any other testifiers in the room? Please come forward.
I'm sorry, Chair. I thought that our testimony was submitted. My name is Rasha Araki, the Executive Officer for the Board of Physical Therapy, testifying on behalf of the board. We stand on our written testimony providing comments on this bill. Thank you.
Yes, please provide us with a copy. Let's see. And our members will get that. Okay, I have any questions, members? Mr. Not Kefalis. What is your name? Sorry.
Jonathan Helton.
Mr. Helton. Would it be a material change to add to the immunity clause grossly negligent or negligent?
That would be something that I think we would probably have to ask the Compact Commission, as I don't know the answer off the top of my head.
Okay, can you folks look into that? Because I'm going to move this bill and the next bill with that kind of language, and I think it should not change. It's not a material.
Yes, we will check with them.
Okay. Mr. Oy? Would the addition of that language to the immunity clause give you a little less heartburn?
I think that would help definitely. You know, it does narrow the scope of that immunity quite substantially. Of course, we still maintain the position that immunity in this instance shouldn't be provided, but you know that language does provide some additional scope, narrowing of the scope in this instance.
Okay, I think with all of these compacts, what we want is immunity for the board members who serve as, in fact, kind of administrative functions.
Right.
Clearly, we don't want to, like if a doctor is serving on the board and goes out and does something negligent outside of the scope of their practice, we don't want them covered. So
Right.
if we can work on that language and if you can connect with the commission, because this is going to persist if we continue to go down this route of compacts, and we need to resolve this in the favor of injured plaintiffs who we don't want to constrain their ability to rightfully go through and get compensation if needed.
Right.
Thank you.
Thank you, Chair.
Board, DCCA representative. Maybe not the board, but the DCCA representative who spoke to it being an unfunded mandate.
Yes, thank you. I apologize for standing up late.
No problem. Okay, so my question is, as we go down this road of potentially having more compacts.
Correct.
There is more work done, but there's also work saved because a lot of the work is done by the commission and the processes to make sure that that happens. We're going to be giving you potentially additional positions to do the medical licensing.
Correct.
Will that kind of additional staffing overlap with the kind of staffing that might be needed for physical therapists?
Well, and I'm going to be very honest with you here. We are so short-staffed right now. So the additional staffing would assist not only for the medical compact, but it will not overlap because for the medical compact specifically, and I know we're not on that bill yet, but if we are selected as the home state, we are expected to process these applications expeditiously. We have to vet them, we have to primary source documents. All of that takes time and effort. We also, the funding that I was indicating in the PT testimony, it's not only for an office assistant, but it is also to include funding for our database to make those appropriate changes so that we can work with the compact or the commission to create an API to transfer the information.
Okay. This is a similar process that you're going to have to work with if we were to implement the medical.
Correct.
Okay. All right. Thank
Thank you.
Any other questions? All right. Seeing none, we will move on to the big one, the Interstate Medical Licensure Compact, Senate Bill 674 SD1. Testimony in support, Hawaii Medical Board. You should just stay up here.
Good morning, Chair, Vice Chair Alani Keoki, Executive Officer, as well as the Licensing Administrator for the Professional and Vocational Licensing Division. The board will stand on its written testimony in support of this, requesting additional funding, as well as asking that HRS Section 8466-2.7 be amended to allow the board the authority to run criminal background checks. We also ask that the language regarding the department creating rules be struck out. It's not necessary.
Okay.
Thank you.
Esther Brown, Regulated Industries Complaints Office, comments?
Morning, Chair, Vice Chair, members of the committee, Esther Brown, and I'm going to stand on my written testimony offering comments. Thank you.
Thank you. Hawaii Pacific Health, Les Chung. It's early, I get it.
And I'm not less.
Queens Health System, J.C. Mikulina.
Chair, we'll stand in strong support of this measure. Thanks for hearing the bill.
Thank you. Aloha Care in support, Paula Arcina.
Stand on our testimony support.
Thank you. HMSA, Ms. Diesman. In support.
In support, and sorry, as much as I'd like to stand, I do want to make sure, like, while we're supportive of the amendments that are being requested from Alani, we do want to ensure that the language is identical in substance relative to the compact. So we might just want to make sure that if we're striking language, that it still meets the needs of being comparable for the compact's purposes. Thank you.
Thank you. Mr. Abe, Hawaii Primary Care Association, in support. Healthcare Association of Hawaii, Paige Choi, in support. Hawaii Association of Health Plans, in support. Kupuna Caucus of the Democratic Party of Hawaii, Martha Randolph, in support. Stephanie Sakamoto, HPMA, in support. Mr. Mark Alexander, Hawaii Medical Association, in support. Mr. Wed, is that your,
Hilton.
Mr. Hilton, let me write that down. For Grassroots Institute of Hawaii. Comments. Again, and it's Mr. Hilton? Hilton. Okay, Elizabeth Roney DeYoung, in support, individual. Nash Witten, individual, in support. Dr. Martin Senti, individual, in support. Evan Oy, comments?
Chair, Senator with comments, noting concerns.
Thank you. Hawaii COPD Coalition, in support. National Organization for Rare Disorders, in support. Any other testifiers via Zoom? Any other testifiers in the room? No other lay testimony? Members, questions? Mr. Hilton, please to the podium. I am curious, what are the amounts and fees that each member state has to pay?
I think that would differ by state, but we'll be sure to check.
Okay, is that, I mean, that's another cost.
Yes, should be.
Okay, can you, I'm just curious, I mean, is it based on population, or could it be, like, is it an extremely expensive amount on an annual basis?
I don't believe so, but that's something I'll have to check with you. I should
Okay.
check with and get back with you. Sorry.
I would be very interested in what the fee structure is. And again, Mr. Helton, just the comment about adding negligent and or grossly negligent, and
Yes.
that changes the substance. I would be very interested in knowing that. Thank you. Members, any other questions? Seeing none, relating to loan repayment for healthcare professionals. Senate Bill 164, Senate Draft 2. We have testimony from Department of Health in support. Testimony in support of Department of Labor and Industrial Relations. Testimony from University of Hawaii, Rhonda Roldan.
Hi, good morning, Chair.
Thank you. Kaiser Permanente, testimony in support.
Morning, Chair. With Canada, written testimony in support.
Thank you. Mr. Robinson, Hawaii Pacific Health, in support.
Yep.
Hawaii State Center for Nursing, Ms. Reichart.
You stand in order for in support. Thank you.
Ms. Arsina Aloha Care, in support.
Thank you. We'll stand on our testimony in support.
Mr. Abe, Hawaii Primary Care Association, in support. Hawaii Medical Association, Mr. Alexander, in support. Hawaii Substance Abuse Coalition, Alan Johnson, in support. HDS, Hawaii Dental Service, support with comments. Healthcare Association of Hawaii, Ms. Choi, in support. Hawaii Medical Association, Dr. Bernard Robinson, in support. Kupuna Caucus of the Democratic Party of Hawaii, Martha Randolph, in support. Queens Health System, in support, J.C. Mikulainek. Nash Witten, individual, in support. We have testimony in support from Hawaii Psychological Association, Alex Lipton. Testimony in support from Hawaiian Islands Association for Marriage and Family Therapy. Any other testifiers via Zoom? Seeing none, any other testifiers in the room? Seeing none, members' questions?
Mr. Chair, we'll stand in support and submit testimony.
Okay, HMSA standing in support and will submit testimony. Seeing no questions or concerns, all right. Moving to Senate Bill 599, SD1, Respiratory Therapist Supervision. Testimony in support from DCCA. Lonnie Kigogi, as well as the Hawaii Medical Board.
Yes.
Okay.
I will stand on both testimonies in support of the measure. So for PVL as well as the Hawaii Medical Board. Thank you.
Thank you. Board of Nursing in support.
The board will stand on its written testimony in support. Thank you.
Thank you. Testimony in support, Kaiser Permanente, Mr. Ching.
Chair, with that, another testimony support. Thank you.
Okay, Hawaii State Center for Nursing, Ms. Reichart, in support. Mr. Robinson, Hawaii Pacific Health in support. Mr. Wong, Gary Wong, Hawaii Society for Respiratory Care in support. Hawaii Academy of Physician Assistants in support. Mr. Denny, Hawaii Association of Professional Nurses, Mr. Bradley Kuo in support. Puna Caucus of Democratic Party of Hawaii, Martha Randolph in support. Any other testifiers via Zoom? Seeing none, any testifiers in the room? Seeing none, any late testimony, members' questions? Board. Someone from the board, maybe medical board?
Yes.
I am very inclined to put a good date of June or July 1st, 2023 onto this bill, a clean date, and make it effective quickly, because it feels like it seems like it's just kind of a little bit of housekeeping. Would that be problematic?
No.
Okay. Can I have someone from the health plans, maybe, or someone from HMSA on this bill? Is that a problem if this is made effective July 1st, 2023?
I'm thinking not for us because we didn't, this is the respiratory system.
Therapist.
Yeah.
No impact on insurance. And
Yep.
can I have someone from possibly
Yep.
Kaiser? Any problem if this automatically goes in, because I just think it helps everybody?
No, Chair. I think this is pretty much as you characterize it, a housekeeping measure. You know, as far as the physician assistants and nurse practitioners, this already kind of aligns with their medical practice. But, you know, state law prohibits respiratory therapists from being able to receive any orders except from physicians. So, yeah, I think making this a clean date would be great to continue.
And not postponing it to December?
Yeah, as long as the medical, it seems like the medical board and nursing boards are fine with that. We'd be very supportive of that. Thank you, Chair.
Okay, wonderful. Thank you. Seeing no other questions, members? All right, moving to Senate Bill 693, Pharmacist. Testimony in support from the University of Hawaii. Comments? Department of Human Services, Ms. Betts or her designee, Ms. Judy Moore-Peterson.
Good morning, Judy Moore-Peterson, MedQuest Administrator on behalf of the Department of Human Services. We do stand on our written testimony offering comments. I'd like to draw your attention to the last paragraph of our testimony that's requesting in Section 8 an extended effective date or implementation date. Thank you so much.
Thank you. Ms. Ondo, State of Hawaii DCCA Insurance Division, comments? Thank you. Board of Pharmacy, James Kizuski, in support. Did I pronounce that correct?
Yeah, that was great. Good morning, Chair and Committee. I am James Kizuski, Executive Officer for the Board of Pharmacy. The Board of Pharmacy will stand on their testimony in support. Thank you.
Thank you. Hawaii Pacific Health, testimony in support, Mr. Michael Robinson. Testimony in support, Hawaii, AARP Hawaii, Audrey Suga Nakagawa.
Good morning, Chair, Vice Chair. This is Audrey Suga Nakagawa, Advocacy Director for AARP, and AARP is in support of this measure. Pharmacists provide a very essential and complementary services that can help address and bridge the gap that's being provided, that's occurring due to our physician service, physician shortage. And so, you know, this does help improve timely access to health information and health education, as well as the kind of clinical services that are within the scope of the pharmacist practices, and they should be compensated appropriately for the valuable service that they provide to patient care. Thank you.
Thank you, Ms. Suga Nakagawa. Hawaii Pharmacist Associations in support. Corey Sanders.
Good morning, Chair, Vice Chair, and members of the committee. We stand on our written testimony. I did want to address Ms. Judy Moore-Peterson's comment about a 7/1/2024 effective date. We are completely on board with that. We've also had some great conversations with some of the payers in the room, and we understand that there's maybe some smaller details that need to be worked out with implementation prior to going into effect. But we believe that 7/1/2024 is an appropriate amount of time to do so, and we're happy to connect to national representatives in other states that have successfully implemented this bill as well. So here for questions. Thank you.
Thank you. Hawaii Primary Care Association, Eric Abe. KTA Superstores, Toby Taniguchi in support. Community First, testimony in support, Randa Kurohara. Dana Wong Otis of the Family Medicine Center, Family Medicine Center in support. American Pharmacists Association in support, Mr. Michael Murphy. The keto prescription is Jody Nishida in support. East Hawaii IPA doing business as Big Island Docks in support, Susan Mochizuki. HMSA, Ms. Diesman, comments?
Good morning again, thank you. HMSA is very supportive of ensuring access and ensuring pharmacist services are utilized to the best of ability relative to creating rural access as well. I think our concern and unfortunately probably really our opposition to the bill at this point is that we think that an auditor's study should be conducted first so that we can understand the financial and social impacts. There are a couple of issues at bay here. The bill is somewhat convoluted in terms of whether or not it requires any willing provider and pharmacist to contract with a plan versus our network providers. And obviously most of them are in our network, but it is confusing from a statutory perspective. We're also concerned that, for HMSA, as I think the chair is aware, we have a payment transformation model in place with primary care. So docs are compensated to do these services. And so an unintended consequence actually could be a rise in healthcare costs, because if patients were going to the pharmacies for these services and the docs in particular weren't aware of that, they're also being compensated. But also from a quality of care perspective, we're concerned that the clinical integration that we're really trying to move toward is not going to actually be put into practice, and that's a real concern for us long term. So we do think that the auditor's study first would be worthwhile. It'll allow us more time to really work with the pharmacist community to really understand the best model of care moving forward for the community. Thank you.
Thank you. Queens Health System, J.C. Mikulainek, comments?
Sure, Chair. I'll stand in support.
Thank you. Comments from Kaiser Permanente. Mr. Kirimitsu.
Good morning, Chair, Vice Chair, and committee members. Kaiser stands on his testimony offering comments. Thank you.
Thank you. Hawaii Association of Health Plans, comments. We have a number of individuals mostly testifying in support. We also have a testimony from members in support. Is there anyone on Zoom who would like to testify? Anyone in the room who would like to testify? Seeing none, and no other late testimony? Seeing none, members, questions? I have a question. I think, Mr. Ito, you're on the hot seat. Sorry. I generally concur that I believe that the auditor should do a study on this. But in some ways, some of the things that apparently the pharmacists are doing are already covered services. So it's not necessarily an increased mandate, is it? Or can you explain that a little bit?
Well, I think we're looking at it as whether it's an expansion of services that are not currently covered, and we realize there are covered services that are covered right now. It's what is the scope and possible expansion that might be subject to the legislative auditor study. I mean, that's kind of the way we're reading it.
Okay. If some of the language that constrains participating providers and in-network, because I also understand that concern, does that then also constrain and then make it less of a mandated service, a new additional mandated service? because what's happening is it's going to be reimbursement for services that occur currently under the plans, right?
Right. I mean, the division is not opposed to really expanding and making services available, in the state. I mean, just to be clear, we're just commenting with respect to, in our view of the way the bill is written, there's a need to look at, through a legislative study on the impact. And we're just pointing out, I think there's ambiguity within the bill that needs to be clarified to avoid confusion. So.
And I think you made the precise point why we need a study. Thank you.
Thank you.
Thank you. Members, any other questions?
Chair, sorry, we will get our testimony. If I could provide some comments.
Yes, please come forward. And this is from Aloha Care, Ms. Arsina, to accepting late testimony.
Good morning, Chair and committee members. Thank you for the opportunity to comment. We will get our written testimony.
I'm sorry, we actually had it. We do have I must have skipped over you.
Oh, no problem. So we also have some concerns, but we entirely support the intent of the bill to increase access to care for residents of Hawaii by enabling pharmacists to practice at the top of their license. That, in principle, is something we support entirely. We do share the concerns that were expressed earlier about the language implying that this may require health plans to reimburse to any willing provider. And there are a number of administrative concerns that we need to work out, and we would appreciate some time to continue to work with the Pharmacist Association. One of the issues is that currently we contract with pharmacies, not pharmacists. So we're going to have to figure out how to bridge that transition, and we would appreciate more time, but we are committed to continuing to work with the advocates for this measure.
Thank you.
Thank you.
Thank you for those comments. Any other comments, testimony? All right. Well, I'm sorry. Questions? No further comments. We've got enough comments. Any members, questions? All right, moving to Senate Bill 384. This is relating to access for disabled persons. We have testimony in support. State Council on Developmental Disabilities, Daintree Bartoldes. Testimony in support, Disability and Community Access Board, Kirby Shaw.
Yes, DCAP stands on its testimony in strong support of the bill.
Thank you. Hawaii Disability Rights Center, testimony in support, Lou Erdeshek. Mr. Ken Farm, individual testimony in support. Any other testifiers via Zoom? Any other testifiers in the room? Any other late testifiers? Members, questions? Mr. Shaw?
Yes.
You can just stay right there.
All right.
I just wanted to say thank you and appreciation for you being here. I think this bill is quite interesting. So counties have not adopted ordinances to the effect to effectuate the ADA?
Well, they're obligated to comply with the ADA as it stands, but in this particular situation, we have a law that's been in existence for 20 years, and there's been no enforcement of the law, and so we're looking at another statute, 29173, which requires parking spaces at electrical vehicle charging stations, and so that legislation enables the counties to enact ordinances to enforce the requirements. So we're looking at that model to have the same type of enforcement mechanism. So we're looking at likely building departments within their scope, their purview of doing these kinds of inspections and reviews.
Thank you. Thank you for bringing this issue to our attention. Members, any other questions? All right, seeing none, moving to Senate Bill 612, SD1, relating to service animals. Members, I will say this is something that we heard under House Bill 871. So this issue is not new to us. Department of Human Services, testimony in support. Testimony in support, Hawaii Civil Rights Commission. Testimony in support, Disability and Communication Access Board. Mr. Shah?
Yes, stand on our testimony in support.
Thank you. Hawaii, again, Hawaii Civil Rights Commission.
Excuse me.
Robin,
Excuse
go
me,
ahead.
Chair, yes.
Go ahead.
Chair, Vice Chair, members of the committee.
I want to clarify that the Civil Rights Commission did not submit testimony in support of the bill. We only submitted testimony in support of subsection B. Our testimony also lists some concerns. We do have concerns about nonprofits and the effect on like the rescue organizations if they have to comply with this. But we did not, we really only support subsection B of this bill.
Okay, thank you. Thank you for that clarification, and I will note it was comments and concerns.
And should the committee have any questions, we're available after testimony.
Okay, thank you. Ms. Yamaki, Retail Merchants of Hawaii.
Aloha and good morning. Thank you for this opportunity. We are in opposition of this Senate bill as stated and stand on our testimony. However, we would like to say that we prefer the House version of this measure. Thank you.
Thank you, Ms. Yamaki. Mr. Fritz, individual in support.
I'm here. My name is Peter Fritz. Good morning, Chair, Vice Chair, members of the committee. I support this bill, which will help curtail the misrepresentations of buying and selling emotional support dogs, and they're identifying equipment as having equal access rights as trained service dogs. The selling of the emotional support dogs and identifying equipment as entitling them to have the same access rights as service dogs creates confusion for the owner of the animal and us. But it also puts untrained animals in uncomfortable, scary, and dangerous situations. Legitimate service dogs have been, as well as innocent bystanders, have unfortunately been hurt by these untrained animals. And I'm aware of a situation where an untrained animal brought into a restaurant attacked a service animal, and that service animal could not be retrained. As a service animal, it was always afraid of being hurt. So I do support this bill. Thank you for the opportunity to testify.
Thank you. Vicki Kennedy, individual in support. James Kennedy, individual in support. Any late testimony? Any testifiers via Zoom? Any other testifiers in the room? Seeing none, members, any questions? Seeing none, that is the conclusion of our testimony. Again, we will be doing decision making on all of these measures at 11:30 today. Members, we are in recess. Good morning. Convening our Committee on Health and Homelessness. Today is Wednesday, March 15th, 9:45 a.m. We are in conference room 329. Members, we have 3 bills on this agenda, and we'd like to get through this expeditiously. I'm not imposing time limits at this point, but would ask that members of the public please be cognizant. We want to get these bills through the legislative process, so we definitely need to make sure we can complete this by 10:30. Practice of this committee is to do decision-making at 11:30 a.m., so we will defer decision-making on all of these bills until that time. Because we do have Zoom participants, should we lose you, we may have to stop the proceedings, but please just try to work with our very competent staff who are manning our Zoom and virtual links. On that note, we're going to start first with our Senate Bill 975, Senate Draft 2, relating to health. First up, we have testimony and support, Department of Health.
Good morning, Chair Bellotti and Vice Chair Takenouchi. And I'm sorry, take a breath. I'm Lola Irvin, representing Dr. Kenny Fink for the Department of Health, and I thank you for the opportunity to provide this testimony in strong support of SB 975 SD2. To keep it short, you'll notice that the reason why public health is concerned is on the last page of our testimony, we show you a graph that shows what's happened with cigarette smoking. So you can see the trend lines and how well the policies that have been set by this legislative body has worked, along with the prevention campaigns that we have done on behalf of our youth. And then we can see that not having parity in terms of policies for taxation for e-cigarettes and their accessibility and availability, we can see then that we have this rising use of nicotine products and also of products that long-term our children are being really experimented on, because we do not know the long-term impact on the lungs of our children and just in terms of their entire body, in terms of what will happen as they're consuming these products that are not regulated. And so I thank you for the opportunity to provide testimony, and we do ask that SB 975 SD2 remain intact and be put into Chapter 245 of the taxation structure. Thank you for the opportunity to testify.
Thank you. Attorney General Richard Stacy or Chelsea Okamura in support. Okamoto in support.
Hi, good morning. Can you hear me?
Yes, I can.
Hi, good morning, Chair, Vice Chair, members of the committee. My name is Rich Stacy. I'm a Deputy Attorney General, Unit Supervisor for the Tobacco Enforcement Unit. Our department is in strong support of the bill, which would finally allow for electronic smoking devices and e-liquid to be taxed appropriately, like other tobacco products. Our unit is also tasked with registering electronic smoking device retailers. Currently, we have 695 registered. 90% of those also have tobacco retail permits with the Department of Taxation. So they have to register with us and DOTAX, separate systems. It creates a lot of confusion and it's very inefficient. So we do urge that this be passed, and what this would do is it would dovetail them into DOTAX's structure, which is a electronic structure rather than our paper structure. And the repeal of Part 12 of Chapter 28 would then make the whole process more efficient. I'm available for questions. Thank you.
Thank you, Mr. Stacy. Department of Taxation, Gary Suganuma, or representative.
Good morning, Chair Bellotti, Vice Chair Takenouchi. My name is Kathy Nee. I'm representing the Department of Taxation. Department submitted written testimony with comments. I would just like to note that the department does respectfully request that the effective date be no earlier than January 1st, 2024, if this bill is passed, just to allow us time to update the relevant forms and the increased fees. Thank you. I'm available for any questions.
Thank you. That's a fair comment. Thank you very much. Testimony in support, Hawaii County Council, Jennifer Kagiwara. By Zoom, if not. Hawaii State Teacher Association, Laverne Moore in support.
Aloha, Chair and Vice Chair of the committee. The Laverne Moore speaking on behalf of Osatui Jr., President of the Hawaii State Teachers Association. We stand on our written testimony, but I will testify on what teachers are seeing in their classroom. Teachers in Hawaii do not need research to tell us the results of e-cigarette use among our youth. Teachers witness firsthand daily, starting with kindergarteners who are vaping all the way through elementary, middle school, and high school. Student vapers have reduced impulse control. They have mood disorders. They have deficit in attention and cognition skills. Lots of absenteeism and poor grades. Eventually, in high school, they become dropouts. Their behavior is disruptive, unpredictable. They leave the classroom whenever they feel like it, which leads to a bigger problem in our schools. Students who are addicted to vaping flavored tobacco products are creating emotional harm, which they are inflicting on the rest of the students who are there to receive a quality education. Due to their erratic behaviors, teachers and students have been vulnerable to threats and possible physical harm. The health department talks about the health impact on our students. Teachers are letting you know that education is not happening in our schools when you have students who are have erratic behavior and cause a lot of disruption. Legislators, are you going to continue allowing these behaviors to happen in our public schools and allowing the tobacco industry to profit in the billions while the long-term health, safety, education, and lives of our future generations are at stake? We want our children to become productive and healthy citizens in Hawaii. The HSTA strongly asks you to support this bill. Thank you for the opportunity to testify.
Thank you, Ms. Moore, and thank you for being here with us during your spring break, when you should not be working and you should be enjoying your spring break. Thank you, thank you. Mr. Wiseman, American Heart Association, in support.
Thank you, Chair Bellotti and Vice Chair Takenouchi. I don't know how to follow that last testimony, but that basically is powerful enough reason to pass this bill. But now you've got my written testimony. It's kind of lengthy, so I'll just emphasize that e-cigarettes are not safe. There's growing research from a cardiovascular standpoint that they are at least not as safe as, or not safer than regular cigarette smoking, and perhaps they could eventually be shown to be more dangerous than cigarette smoking. Adults who try to use these to quit, they don't quit nicotine addiction. They stay nicotine addicted. In fact, e-cigarettes have much more nicotine than cigarettes, and nicotine is the problem from a cardiovascular standpoint. And you end up a lot of people who try to use them to quit end up with dual users, which makes the problem even worse from a health standpoint. We emphasize that the tax needs to create parity with other tobacco products to be effective. We know taxes have been proven to be effective at reducing use, especially among price-sensitive youths, and we need comprehensive measure to effectively set a foundation for all these other measures that we're trying to also get done, like the flavor restrictions. They all work in synchronicity, and to be effective, you need to have comprehensive efforts, and this bill would do that. So we ask you to support this. Mahalo.
Thank you. We have testimony from Tobacco Free Kids Action Fund. Ms. Lindsay Freitas in support.
Good morning, Chair, Vice Chair, and members. I'm Lindsay Freitas with the Campaign for Tobacco Free Kids in strong support of SB 975. It is crucial that we adopt comprehensive regulation and taxation for e-cigarettes. Taxing and regulating all tobacco products the same is crucial so that we don't establish market favorites that lead users to favor one product over another. Youth especially are sensitive to variations in price and regulation, and the current system we have here is not setting parity between e-cigarettes and traditional tobacco, which is contributing to our youth e-cigarette epidemic. So for these reasons, we're in strong support of SB 975. Thank you.
Thank you. Ms. Kurisu from HMSA in support. Thank you, Mr. Owl. Pedro Haro, American Lung Association in Hawaii in support.
Aloha, Chair, Vice Chair. Pedro Hara with the American Lung Association. Apologies for not being able to be there in person. We send on our written testimony, obviously in support. One of the things that I just wanted to point out of our testimony is that, the really importance of bringing price parity between tobacco and vaping is, as the previous testifiers mentioned, that their youth are more sensitive to those price increases. What we don't want is to have this shuffling between regular tobacco to vaping to regular tobacco to vaping. That's a strategy that tobacco companies use, is if they have price differentials between the two, then they can keep switching them back and forth between one to the other and just creating this loop of addiction just with a different device. So it's really important to be able to bring that tax parity within this bill. Thank you very much.
Thank you. Hawaii COPD Coalition, Valerie Chang.
Hi, thank you so much. Sorry. Thank you so much for allowing me to testify in strong support of this measure, Chair and Vice Chair. There is evidence of emphysema changes in the lungs of vapors, and so we don't need more than the 45,000 people we already have that have COPD in our state. As you know, this is causing our state to lose a lot of money in healthcare costs, and we don't need to add to that burden. All the other people have already testified about why this is such an important measure, and I thank you so much for giving it very strong consideration and hope you will pass it as soon as possible. Thank you.
Thank you. Mr. Abe, Hawaii Primary Care Association, support with comments. Ms. Holly Kessler, Hawaii Public Health Association. Support. Papa Ola Lukahi, Sarah Kamaka Viviole in support. Joseph Cohn, We Are One Incorporated, support. Mr. Scott Stensrud. Coalition for Tobacco-Free Hawaii Youth Council, in support. Kim Nguyen, Hawaii Dental Association, in support. Parents and Children Together, in support. Mr. Ryan Kusumoto, Student Health Advisory Council of the UH Student Health Advisory of the University of Hawaii, in support. Lindsay Stroud, Taxpayers Protection Alliance, comments. Go ahead, Mr.
Yes, ma'am. Can you hear me?
Yes. Go ahead, Ms. Stroud.
Okay, thank you. Chairwoman, Vice Chair, members of the committee, thank you for your time today. My name is Lindsay Stroud. I'm Director of the Taxpayers Protection Alliance Consumer Center and a visiting fellow at the Independent Women's Forum. I did submit written testimony, and I wanted to kind of go over these numbers. So, like other states, efforts to attack tobacco harm reduction products, including vapor products, are all in this effort to address the so-called youth vaping epidemic. There is no youth vaping epidemic. It was correct to use this term to describe the rapid increase in youth vaping between 2017 and 2019, when then in that year, 20% of middle and high school students were currently using e-cigarettes. This data comes from the CDC's National Youth Tobacco Survey, which found in 2022 that less than 1 in 10, or 9.4% of US students, were currently vaping. Opponent organizations keep trying to downplay these declines, but according to the CDC, 99.3% of students completed the 2022 National Youth Tobacco Survey in a classroom setting last year. And in fact, in just February, Brian King, the Center for the Tobacco Products at the FDA, did recently declare that the FDA quit using the term youth vaping epidemic. Now, I want to talk about adult e-cigarette use. In 2021, 6.1% of adults in Hawaii were currently vaping, which was actually a 27.1% increase from 2017. And nationally, in 2021, 6.7% of adults were current e-cigarette users, or about 17.3 million adults. Now, Hawaii doesn't currently have an excise tax on vapor products. It does have a state excise tax on tobacco products. According to the data released from the CDC last week, of the adult e-cigarette users in 2021, 40.4% of them were former smokers. And cigarette taxes have already disproportionately harmed lower income persons in the Aloha state. In 2021, among all adults that were earning $25,000 or less in Hawaii, 21.2% of them were currently smoking, compared to only 7.3% of adults that had earned $50,000 or more. Again, excise taxes fail to address the declines in youth vaping and disproportionately harm lower income persons. Policymakers should refrain from them. Thank you for your time today.
Thank you, Ms. Stroud. Mr. Guy Bentley, Reason Foundation.
Good morning, Chair, members of the committee. Thank you so much for the opportunity to testify. My name is Guy Bentley. I'm Director of Consumer Freedom at the Reason Foundation, and we're a non-profit public policy think tank. When considering the issue of taxation of e-cigarettes and also nicotine pouches, which would also be covered in this bill, it's important to recognize that the Food and Drug Administration recognizes that there is a, quote, risk continuum when it comes to tobacco products, with cigarettes being the most dangerous and alternatives like e-cigarettes being far less dangerous. Indeed, the head of the FDA's Center for Tobacco Products says it's a positively good thing when smokers switch from cigarettes to e-cigarettes. Now, talking about the tax parity between e-cigarettes and combustible cigarettes, which many presenters have already spoken about, modeling funded by the National Institutes of Health shows that by creating tax parity between these products, taxing them the same, means that more people smoke cigarettes, including young people as well as adults, and it disincentivizes adults from switching to less harmful products. So unfortunately, by creating a tax parity, we're actually incentivizing the more dangerous product over the less dangerous product. And now we should also recognize that many of these products have in fact been authorized by the FDA as, quote, appropriate for the protection of public health. So sound health policy really should dictate that we tax the most dangerous products the most and far less dangerous products the least, in order to incentivize making the right decision for people's health. And we should really listen to our public health officials at the FDA when they are publishing data on this and about the health effects of these kinds of policies. Thank you so much for your time.
Thank you, Mr. Bentley. Tax Foundation of Hawaii, Mr. Tom Yamachika.
Good morning, Chair and members of the committee. This is Jade McMillan on behalf of the Tax Foundation. We've submitted comments on the measure. We'll stand on our written comments. Thank you.
Thank you. Cigar Association of America, Brian Fotick, opposition.
Thank you, Madam Chair. My name is Brian Foydick, and I appear today on behalf of the Cigar Association of America. CAA is the premier voice of the cigar industry in the U.S. We oppose Senate Bill 975 and how it would criminalize the shipment of products to adult consumers. Our members include the largest internet retailers of premium cigars and pipe tobacco. These companies have been in business for decades, and as responsible retailers, comply fully with all federal, state, and local laws. They use sophisticated third-party software to perform age verification on every sale, ensuring none are made to those not old enough to legally purchase products. Further, nearly all of those members impose a minimum age of 21 before it was federal law. The preamble to this bill recites many facts and issues related to youth usage of e-cigarettes in Hawaii, but makes no mention of youth usage of cigars. While there's always room for improvement, current high school use of cigars in Hawaii is at the lowest level ever measured, 2.8% from the 2019 Hawaii Youth Tobacco Survey. While less than 3% of Hawaii youth reported cigar use in 2019, over 33% of Hawaiian youth reported current use of e-cigarettes in 2019. For these and other reasons, federal law continues to allow internet sales of cigars and pipe tobacco as opposed to other products. At the time of the original 2010 version of the federal Prevent All Cigarette Trafficking Act, or the PACT Act, and the 2021 amendment to the Act, Congress recognized that cigars and pipe tobacco were used differently than cigarettes, smokeless tobacco, and e-cigarettes, and in both instances made the informed decision to not include these products within restrictions of the PACT Act. In fact, cigars and pipe tobacco are the only products that can be legally shipped to adult consumers using the U.S. Postal Service. This bill is excessively broad, and we would respectfully hope that you'd consider changes. It has the laudable goal of addressing youth usage of e-cigarettes, but it unnecessarily prohibits the online sale of cigars and pipe tobacco, products that, as indicated, youth are not using in significant numbers. Rather than include cigar and pipe tobacco in a bill making all shipments to legal adults unlawful, the Cigar Association would welcome the opportunity to work cooperatively with you, as we have done and continue to do in other states, to create a path to compliance for responsible online cigar and pipe tobacco retailers to collect and remit the Hawaii excise tax on direct sales to adult consumers. CAA, along with the Premium Cigar Coalition, has been working with the Federation of Tax Administrators Uniformity Committee to craft model legislation. This legislation has been successfully
Mr. Foytik, I'm
enacted.
sorry, can you wrap this up? Because we do have to move on, but I understand
Yes.
your point, and we have your very detailed written testimony.
Okay, this has been enacted in Maryland, Michigan, North Carolina, Indiana, and Virginia, and other states are considering it currently. So we would very much appreciate the opportunity to work with the legislature and the Department of Taxation to find a legal avenue for Hawaii to collect excise taxes on those transactions rather than criminalize them. Thank you very much.
Thank you so much, Mr. Foytik. Consumer Choice Center, Elizabeth Hicks, in opposition.
Thank you, Madam Chair. My name is Elizabeth Hicks from the Consumer Choice Center in strong opposition. Simply put, this bill is going to do more harm than good if passed. An increase in taxes on vaping products and other alternative nicotine products will lead to much higher prices for consumers, pushing many former smokers to switch back to smoking combustible tobacco. Tragically, 1,400,000 Hawaiians lose their lives to smoking-related illnesses every year, but considering that studies have shown vaping to be 95% less harmful than smoking, ensuring that adult consumers have access to these products will ultimately lead to fewer cigarette smoking-related deaths within Hawaii. More than 100,000 Hawaiians vape, and according to data from the Hawaii Journal of Public Health and Medicine, the largest demographic of Hawaiian vapers are actually 65 years and older in age, and started vaping as a means to quit smoking combustible cigarettes. This tax will disproportionately harm lower-income individuals throughout the state, robbing them even more of their income and penalizing them for choosing less risky alternatives to combustible cigarettes. This policy would also lead to increases in smoking-related healthcare costs, which are already costing your taxpayers over $141 million annually through Medicaid expenses alone, and we can expect that number to increase if this bill is passed. We all know that smoking-related illnesses are serious and can lead to cancer. And on a personal note, after being around secondhand smoke for most of my life, this past year I received my own cancer diagnosis, undergoing chemo, radiation, immunotherapy, multiple surgeries, and I can assure you that I would not wish this on anyone. So considering this committee is focused on protecting public health, embracing vaping as a harm reduction tool will help ensure that your citizens are much less likely to end up in a situation similar to mine. Additionally, this tax will result in consumers looking towards the illicit market in order to avoid the price increases. This presents concerns for public health as consumers will be buying unregulated products that do not necessarily adhere to the regulatory standards. Also, unlike vape shops, the illicit market does not abide by age restrictions, therefore making it much easier for youth to acquire these products illegally. I'll wrap up by saying this proposed tax on vaping and alternative nicotine products is simply misguided, as the unintended consequences would only exacerbate the problem that Hawaii is trying to fix, making this particular bill unviable in achieving its desired outcomes. Therefore, I urge you to vote against SB 975. Thank you for the opportunity to testify. I'm happy to answer any questions you may have.
Thank you, Ms. Hicks. Tim Andrews, Americans for Tax Reform, opposition. Matthias Google, National Taxpayer Union, in opposition. Premium Cigar Coalition, Barry Shavitz, in opposition. I see Dr. Julian Libsher here in the committee room, individual in support.
Small correction, Chair, not a doctor.
Oh, not a doctor. Oh,
No.
PhD? No.
Master's in Public Health from the University of Hawaii. Julian Lipsher, testifying as a private citizen. This bill is important because it establishes a statutory foundation for vaping devices. The legislature has enacted numerous pieces of legislation on traditional tobacco products, and these measures have resulted in declines, significant declines in both youth and adult smoking. Now we're faced with the issue of vaping. E-cigarettes have evaded regulation for over a decade. They're the only product without regulatory tax. Comprehensive regulation that includes taxation, licensing, permitting, be a major step in reversing the use of e-cigarettes among youth. Over 2 decades of comprehensive regulation of cigarettes and other tobacco products have saved hundreds of millions of dollars in direct healthcare costs and lost productivity. And e-cigarettes are not an FDA-approved cessation device. Importantly, the measure restricts online sales of e-cigarettes directly to consumers, requiring face-to-face purchases, making it harder for youth to obtain these products via the internet. But licensed tobacco retailers would still be able to receive shipments. encourage that the legislature is encouraged to apply what's been successful strategies for traditional tobacco products to electronic smoking devices and the epidemic of youth vaping. Thank you for the opportunity to testify.
Thank you. Members, we have received testimony, additional testimony from Ms. Peggy Mearswa from Hawaii Pacific Public Health Institute.
Good afternoon, Chair, Vice Chair. Peggy Mearswa with Hawaii Public Health Institute. Thanks so much. The Public Health Institute stands in strong support of this measure. It would create a system that would close the loophole of online sales to minors, includes ESD into the tobacco definitions in Chapter 245, and requires licensing and permitting for retailers. And as many of the testifiers have said before, it creates parity and increases the tax system for electronic smoking devices, which is a proven strategy to reduce youth initiation. And it's a CDC best practice that's helped adults quit and prevent youth from even starting. So you've heard all the testimony. Thank you so much. You know how we feel about it.
Thank you. Testimony in support from Hawaii Association of Independent Schools, Mr. Philip Bossert. We have late testimony from UH Medical School in support. Testimony in support from Dental Hygienist Association Hawaii. We have numerous testifiers in support from individuals, as well as testimony in opposition from individuals. Is there anyone else on Zoom who would like to testify? Is there anyone in the room who would like to testify? Is there any further late testimony? Seeing none, members' questions. I have a question for Mr. Wiseman. So this is a perennial question. How do we, regulate? And there's all kinds of different types of regulations. In your testimony, you highlight that other states have applied different kinds of, wholesaler. What is the magic number if we were to tax, according to some of the charts that you put in?
I think you'd want to go for a uniform wholesale-based tax. Create parity with the cigarette tax in our state. Currently, our cigarette tax is, I think, the 8th highest in the country. And so you'd want to make it paritable with that tax so that you don't create, movement from one product to the other. And then there you see a chart that lists what the wholesale parity would be in our state, which would be, you wouldn't want to go below that. You want to be at least that number or higher. But the key is to create parity. But it's also important. It would be more effective to make it an ad valorem tax, so as you get inflation, you don't have to keep coming back and changing the tax to keep up with the inflation. We used to have an ad valorem tax, which was changed back when we passed the smoke-free era law, which I think was done as a to give the tobacco industry something in return for smoke-free air.
Okay, so. One of the things the testimony has shown, or there's a concern, right, from some of the advocates that there's going to be this bouncing back and forth between tobacco products and e-cigarette products, correct? And that's why you guys want to make the tax levels.
You want it to be equal, yeah.
Okay, but we have 20 states that have adopted reduced tax rates for vape products. We have another 20 states that don't have any tax on vapes. And the other 10 states tax at the same ratio as tobacco. So isn't there a way for us to are you seeing that, that just because you have a reduced rate on vaping products, that people are bouncing back between tobacco and vaping? I would just think that they're gonna smoke what they're gonna smoke, and then it's a tax to get revenue so that we can address some of the social harms and ills that come from these products.
Wherever you leave a loophole, the tobacco industry will take advantage of it and market heavily to move people to the more easy option. So by creating parity, then you don't have that option. They're not going to be able to market something different at a lower price and say you can get this for cheaper. So you want to create parity. That's the goal.
Okay, I hear what you're saying, but I somewhat disagree, because if we know
and
that
not all states are right in what they're doing either.
Yes, but we are now losing the ground because now we don't tax, in it.
We're not doing any tax, yeah.
Yeah.
We need to have a tax that creates parity. Our tobacco tax has proven very effective.
Understood. Okay, thank you.
Okay, thanks.
Any other questions, members? All right, seeing none, let's move on to our next bill. We are now at Senate Bill 1018, Healthcare Association comments. This is our emergency powers bill, members. Any late testimony? Any testifiers via Zoom? Is this for this one? We have testimony and support from Department of Defense, Hawaii Emergency Management Agency. In support. Any other testifiers? Seeing none. Members, our last measure on, questions? Okay, Healthcare Association. Any questions? No questions? All right, members, moving on. Senate Bill 1418, relating to noise pollution. Testimony in support, Department of Health. Testimony possibly in support from Sean Haruno, Department of Health also? Okay. Is it duplicative?
I believe it's a duplicate.
Okay, very good.
So Sean Haruno, Department of Health, Noise Section. We stand on our testimony and available for questions.
Okay,
Thank
perfect. Testimony in opposition, Officer Platt, Honolulu Police Department.
Good morning, Chair Belati, Vice Chair Takinauchi, committee members and staff. I'm Major Randall Platt with the Honolulu Police Department. We stand on our written testimony in opposition to this bill, and I will be available for any questions. Thank you.
Thank you. We have testimony in support from the Waikiki Neighborhood Board. Mr. Robert Finley. Citizens Against Noise, Jay Henderson in support. Free Access Coalition, John and Rita Shockley in support. Unite Here, Local 5 in opposition. Lynn Matusau in support individual. Numerous individuals in support. I will not read through the names. We also have testimony in opposition from the Department of the Prosecuting Attorney, City and County of Honolulu.
Good morning, Chair, Vice Chair, members of the committee, Deputy Prosecutor Tricia Nakamatsu, appearing on behalf of the Honolulu Prosecuting Attorney's Department. We are in opposition to the bill, and certainly not for any lack of concern about the noise issues, particularly in urbanized portions of Oahu. We have heard the repeated complaints of the community. We certainly appreciate the intent of this bill and the other multiple bills introduced this session to try to address these noise issues. And as our testimony indicates, we'd also submitted a bill as part of our package to try to be part of the solution. The issue that we have with this particular bill, the language and approach of this bill, as with the ordinance 43, Bill 43, that was vetoed by the City and County of Honolulu, or the mayor last year, is that it relies at least in part on decibel meter readings. And having spoken, we have actually had conversations with Department of Health, Liquor Commission, various agencies that use decibel meters on a regular basis, and it's a very time-consuming process given the lack of resources, the staffing shortages, and recruiting difficulties that HPDs has had. We are just very concerned that this is not the most efficient use of our officers' time, particularly when we think there may be another way to do it. We have been in talks with the mayor, with city council members, police, and there are other ordinances, and this is just for Honolulu, of course, it's on the ordinance level. But ROH 41-6.1, commonly known as the boombox law, could be possibly modified to address a broader range of noise that would cover things beyond just radios and boomboxes. So that is just one option that we're looking at, but again, this is not for lack of concern, it's not for lack of care. We are simply opposed to this particular approach. We're available for questions, if any.
Okay, thank you. Again, numerous testimony from individuals in support, no other testimony from any organizations. Any testifiers on Zoom? Seeing none. Members, questions? Seeing none. As is the practice of this committee, we will be holding decision-making at 11:30 a.m. on all of these measures, so we are now in Good morning. Convening our committee on March 15th, 2023 for the Committee on Health and Homelessness. It is now 10:30 a.m. We are in conference room 329. Members, this is our 10:30 a.m. agenda. As has been the practices of this committee, we are going to have decision making for the measures on this agenda at 11:30, as well as on the agendas that we had prior to this morning at 8:30 and 9:45. For those of you participating via Zoom, if we happen to lose you, just realize that we may have to stop the proceedings, but if you could work with our very competent staff in making sure that you stay online, or when you have problems to work with them, we will get through this expeditiously. So members, we have 3 measures on this agenda. First up, Senate Bill 465, Senate Draft 2, relating to cannabis. This is a transportation measure. We have testimony with comments from Director Fink, Department of Health. Testimony for comments, Department of Transportation. Attorney General's comments.
Good morning, Andrew Goff for the Attorney General. We did submit testimony, but I wanted to just hit a couple highlights. This bill would allow interstate or inter-island transportation of cannabis for patients under state law. I think it's important to note that it is not legal under federal law. So our concern is that patients might believe that this bill actually makes it legal when it doesn't. Also, the SD2 version made a couple amendments that may confuse some things, and we suggested some language to clear it up. I'm available for any questions.
Thank you. Alchemite Cannabis Consulting, Clifton Otto, in support. Mr. Otto? Dr. Otto? Dr. Otto, you may be muted. We will come back to you, but we have individual in support, Dane Retzlaff. Testimony in opposition, Carolyn Azeltsky. Mark Gordon, individual in support. Another individual in support, Ben L. Any testifiers in the room? Any testifiers on Zoom? Dr. Otto? Is he present?
He is. It's just when he talks, he's not speaking. It's on his side of the.
Dr. Otto, there's a inability for us to hear you. You may be muted. We're going to move on to the next one, but
Someone wants to talk. Someone else.
all right, go ahead.
Hello?
Hello, go ahead. Can you please turn on your camera?
Sure. I'm not that good looking, but here I am. So,
If you can identify yourself and go ahead and testify.
my name is Myron Burney, and I'm a naturopathic physician and a licensed acupuncturist. I need to make sure I'm in the right hearing. Could you tell me what the bill number
This
and
is the Health Committee on Health and Homelessness, and we are discussing Senate Bill 465 at the moment.
and what's that on?
This is on transportation for cannabis.
Yeah, so then I'm very interested in medical cannabis, recreational cannabis, and I support anything that would make it more legal and more accessible, because cannabis is not a dangerous drug. It's a drug of benefit, has a lot of benefit. It's understood to be an adaptogen, which means that it balances everything in the body. Unfortunately, when people start with it, they have an untoward reaction, but once they get used to it, it needs to be ramped up, then it's a very beneficial drug. On a national level, it's in the process of being legalized. I think the president has given already a major pardon for anybody
Thank you,
for
Dr.
simple
Burney.
possession.
Let me interrupt you just a little bit. We need you to focus on the testimony regarding transportation. We understand
Yeah,
that
I
you
think it
support,
should
and
be
so if you could
completely
comment on the
legalized.
transportation.
I think it should be completely legalized. It's a medicine of harm reduction, and there shouldn't be any obstacle or even any regulation on it, it should be just like a head of cabbage. So I support that anything that makes it more viable or accessible, transportable. And basically going back in history, we have to take a look at the definition of interstate commerce and reaffirm that commerce wholly within the state is not under federal regulation. So thank you for supporting the bill.
Thank you, Dr. Burney. And if you could make sure that testimony is provided to our committee chair, our committee staff people, that would be very helpful. So thank you for providing your testimony.
Thank you.
Dr. Otto, Dr. Otto, if you want to testify.
Yes, thank you, Chair, Vice Chair, members of the committee. Sorry about technical difficulties. And thank you for the opportunity to provide testimony in support of this measure. Dr. Clifton Otto, you have my written testimony. I just wanted to add a few comments. This is an important bill for our patients, especially those on Molokai and Lanai, who do not have access to dispensaries on their islands. This bill is also important because it raises fundamental questions about the limits of state and federal jurisdiction that need to be addressed. Our patients in dispensaries don't have a choice. They must violate federal law to participate in our medical cannabis program, but they can do so because of the state's constitutional authority over the interstate use of cannabis, which applies to transportation. Unfortunately, our state executive branch has never gone back to the Department of Justice to find a solution for federal Schedule I. In the meantime, ever since 2014, Congress has been prohibiting the DEA from interfering with state medical cannabis programs and its patients and producers. And there are exceptions to federal law that recognize state authority, like the FAA regulation that allows the carriage of cannabis aboard aircraft if authorized by state law. We should not avoid the benefits of the jurisdictional limits of the state just because of possible confusion. This is why we have rules, and this is why it is so important that the Department of Transportation be involved. Thank you for considering my testimony, and I will be available for questions.
Thank you, Dr. Otto. We don't have any other testifiers in Zoom and no other testifiers in the room. Members, any questions? Chair Rizzuto.
Thank you, Chair Bellotti. Dr. Otto? Yeah,
yes, Representative.
Great to see you again. I know you're a medical doctor. I know we talked about medical cannabis over the years. Are there any other states in the U.S. that allow for the transportation of medical cannabis?
Well, thank you for that question, Representative. I have attached to my written testimony the protocol adopted by the Alameda Sheriff's Department for Oakland International Airport. I think that provides an example of how states can adopt rules that allow for passengers to board aircraft. And I think our situation in Hawaii is unique because it looks like we have areas of inter-island transport that fall within the state.
Thank you. Oakland is a county, not a state, and so, but thank you anyways. And
Oakland International Airport, which is a California airport, and other airports have adopted similar regulations that allow passengers to board aircraft if they are abiding by state law.
What about LAX?
I believe LAX has a similar policy.
If you could give our committee a state that has adopted the transportation of medical cannabis, it would be a lot more helpful. But I did want to thank you. We've over the years discussed medical cannabis a lot, and I just wanted to also thank you. I still got your shirt that you gave me about 5 or 6 years ago. Thank you very much, Dr. Otto. Thank you, Chair.
Thank you. Follow-up question. Is there anyone from the Department of Transportation here? All right, seeing none, I guess I will ask the question if this comes up in the next hearing, but it would have been, for those listening in Zoom land, it would have been, is the Department of Transportation aware of the medical marijuana at the Oakland International Airport checkpoints policy and procedure that has been apparently adopted in their jurisdiction and allows for this kind of transport?
Thank you.
Thank you. All right, seeing no other questions? All right, moving on to Senate Bill 673. This is our bill for use of medical cannabis in healthcare facilities modeled after California law, Ryan's law, I believe. We have first up comments. Department of Public Safety, Jared Radulio.
Good morning. We'll stand on our written comments offering comments on issues with implementation.
Okay, thank you. Comments, Department of Law Enforcement, Michael Vincent. Comments, Healthcare Association of Hawaii.
Good morning, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify. My name is Hilton Rethel, President and CEO of the Healthcare Association of Hawaii. We do have very serious concerns about this bill. We're not making a judgment about the use of medical marijuana. However, our facilities, hospitals, long-term care facilities, home health agencies, hospices are regulated by federal and state governments. And at this current time, until these jurisdictional issues get resolved, we're very, very concerned, our members are very concerned about the use of medical marijuana in a healthcare facility and their potential liability or the ability of the federal government or state government to actually shut down these facilities, which would have a devastating impact on the delivery of healthcare here in Hawaii. So we would ask that the committee either defer the measure overall or, if inclined to move the measure, ensure that the language remains permissive. Thank you very much.
Thank you. We have testimony from Dane Retzlaff in support. Mahina Lani Pulotu in support. Mark Tamosinas Siwanas in support. Jim Bartel in support. Myron Burney, Dr. Burney in support. If he's going, go ahead.
Okay, I'll turn my video back on. Thank you. The word compassionate comes up in this bill, and I've been a strong, my testimony is to underline this area of compassion and ask for, to add in somewhere in this bill or in somewhere, the compassionate clause in healthcare, which was removed about 5 or 6 years ago, or 10 years ago because of fear about physician-assisted suicide. The compassionate clause is not for suicide or murder, but is for compassionate care, which is also in federal law, compassionate care. And we should put this back into healthcare so that other agencies cannot prohibit healthcare delivery, which is what happened during the pandemic. It's very outrageous that the government took a position, the FTC, the FDA, the FCC, against any doctor that said there was some treatment for a virus other than nothing at all. Anybody that offered any suggestion at all was defined as a quack by Bill Gates. And I took the vaccine. Now there's a lot of controversy about this vaccine. I've been treating viruses for over
Dr.
40
Burney,
years
can you restrict your
very
comments?
successfully.
Can you restrict
We
your
need the
comments
compassionate
to the
clause back into healthcare. As this other prior gentleman mentioned, we need to establish what interstate commerce means according to the founding fathers, not according to criminal case law.
Thank you, Dr. Burney. Wendy Gibson Viviani, individual comments. Is she available on Zoom? All right. Ms. Gibson?
Hi, can you hear me?
Yes, we can.
Okay, great. Good morning, Chair, Vice Chair, members of the committee, and thank you for the opportunity to present this testimony on this very important compassionate use bill. I did provide written testimony, and I'd like to stand on my testimony. It's mostly, it's comments because, and I submitted these comments on behalf of any terminally ill medical cannabis patients who are being denied access to their medicines. I'm a medical cannabis patient advocate. I'm a member of the Cannabis Nurses Network, which was a group that was instrumental in helping pass Ryan's Law in California. They initially ran into this same difficulties with, well, they passed the law in 2020, I believe, And Governor Newsom vetoed it because the healthcare facilities raised concerns similar to what we're hearing right now. So they went back to the drawing board and submitted the bill again in 2021. And this time, one of the senators they asked the Centers for Medicare and Medicaid Services if they allowed Schedule I drugs on the private property and what they would do if it was happening. And Medicare and Medicaid regulations don't even address medical cannabis. They haven't even created policies and procedures because they never anticipated that they would have to try to prosecute anybody for doing that. We've got history tells us that the chances of them being prosecuted or in any way is just not likely to happen at all. If you just look at what the trends are, there are hospitals that do allow it now. There are Mayo clinics in at least 2 states that allow patients to use it. There are hospitals in Washington, and so far not one healthcare facility has been threatened with being charged with a federal crime. None have received any threats of their funding being cut off because they allow a terminally ill patient to have cannabis on the property. So this bill in its current form is not going to do much. I suggest that either fix the bill and put it back into the language that mandates this. It says shall allow a patient to use their medicine in certain healthcare facilities rather than may, because it's not going to, nobody's going to be brave enough to invest in what it takes to make this happen. And I fear the patients are just going to be deprived of their medicines for forever.
Thank you, Ms.
So
Gibson. We do have your
defer the bill
testimony.
or fix it. Thank you.
Thank you. Any other, we have Mark Gordon in support. Any other testifiers on Zoom? Any other testifiers in the room? Members, any questions?
Hello. I'd just like to make a short statement about policy. And the responsibility of the legislature is to the consuming public, not to individual
Apologies,
businesses.
we've already taken your testimony. We also have your
Thank you.
testimony, so thank you.
I'm sure you hear me.
Okay, thank you. Any other testifiers? Any other late testimony? And seeing no questions from the committee. All right, members, we are moving on to Senate Bill 962. This is related to medical cannabis, the dispensary, certification, and patients. Senate Bill 962, Senate Draft 1. We have testimony in support from the Department of Health.
Good morning, Chair, Vice Chair, and members of the committee. The department stands on its written testimony in support of this measure, and we're here for questions.
Okay, thank you. Testimony from Eugene Tien, Department of Business, Economic Development, and Tourism.
Good morning, Chair, Vice Chair, and the members of the committee. We stand on our written testimony providing comment. The bill requires DOH and DBAT to prepare a report. And for DOH report is on the demand side. But I assume that the report from DBAT will be on the economic side. But the bill didn't specify the scope of the data. And we would need the supply side of the data, for example, the business investment, their payrolls, as well as their employment. Thank you.
Thank you, Mr. Tian. Testimony in support from David Cole, Maui Grown Therapies. On Zoom? Testimony from Cure Oahu, Sanhai Government Strategies. In support.
Good
Good morning, Chair, Vice Chair, members of the committee. This is Mihoko Ito from Shanghai Government Strategies. We submitted testimony in support of this measure. We do support the entirety of the bill, but would just ask the committee to take a look at two areas. One is that the House version of this measure did contain a provision relating to fees and implementing a reasonable fee structure for dispensaries and production centers. So we'd ask that that be reincorporated. Second, we also made a suggestion in our testimony to look at the use of color letters on labels just to make it clearer and easier for both the workers and others that work in the dispensaries, as well as the patients themselves. So we'd ask for your consideration of those two things, and I'm happy to answer any questions. Thank you.
Thank you, Ms. Ito. Akamai Cannabis Consulting, Dr. Clifton Otto, comments? You have to unmute Dr. Otto. As you're working on that, we have testimony and
Yes, no, I think I'm good. Can you hear me?
Okay, go ahead.
Great. Thank you, Chair, Vice Chair, members of the committee. Dr. Clifton Otto, thanks for the opportunity to provide comments on this measure. I stand on my written testimony regarding pre-rolls or cannabis cigarettes, and I will be available if there are any medical questions. Thank you.
Thank you. We have testimony from Carolyn Azelski in support. Testimony from Ann Chung, individual, on behalf of Pono Life Maui in support. Any testifiers on Zoom? Any late testimony? Any testifiers in the room? Mr. Gantz, and if you could identify who you're testifying with and then provide written testimony to our committee.
Sure, absolutely. Apologize for not getting testimony on time. Randy Gantz with the Hawaii Cannabis Industry Association. We do support this measure. We are asking just for a very small amendment on page 4, section 2. It's talking about the wholesaling between licensees. And the current language says the selling dispensary may transport no more than 800 ounces of cannabis or manufactured cannabis products to the purchasing dispensary within a 30-day period. We would like to add to the end of that, or any other amount with prior approval from the Department of Health. Thank you, and we're here for questions.
Okay. Any other testifiers? Seeing none. Members, questions?
I wanted to make a short statement.
Dr. Burney, is this Dr. Burney? Dr.
Yes.
Burney, I'm going to give you 2 minutes to comment on Senate Bill 962. Go ahead.
Thank you for the 2 minutes, and thank you. I think that I just want to make a general statement that I support actually complete legalization of marijuana. We don't really need any regulations, and we're moving in that direction on a federal level, which will take a lot of pressure off of you folks. I think that the overriding responsibility of the state is to provide for the health and welfare of the consuming public, and is not to protect any business or other organization. So please keep that in mind. I know that you have to conform with federal policies and things like that, but we're going to change that the federal level, and your responsibility is to deliver health care, not to have anything blocking or impeding healthcare delivery in any way whatsoever is a crime. Thank you very much.
Thank you, Dr. Burney, and thank you. You actually did not use your complete 2 minutes. I really appreciate that. Members, any questions? I would like to ask some questions of the Department of Health, please.
Good morning, Chair.
Thank you. Thank you for working so diligently on these amendments and this area. I have some questions, as this is the Senate bill that's moving. We do have House bills that are moving, and I expect and I hope that some of them will continue to move. But my intention is to add some additional amendments to this measure that would continue to strengthen essentially the regulation of medical cannabis, and really provide and clarify that the Department of Health has some very important regulatory duties that you folks, my feeling is, have not really exercised. So on that note, you know, there have been, can you comment on the rulemaking and the fee structure and what are the thoughts on that and how the amendments being asked for by some of the testifiers to reinsert those provisions? Your comments on that?
Sure. So with regards to the references to Chapter 91 rulemaking that have been in some of the measures introduced so far this year, the reason the Department of Health has objected to that is we currently do have interim rulemaking authority, and that allows us to make more timely changes in response to any kind of emerging public health or public safety concerns. The cannabis industry is, in our opinion, still emerging, still changing, and it really is important to protect the public's health that the department have the ability to adapt quickly to concerns. So as an example of that, several years ago there was the EVALI vaping crisis related to vaping cartridges containing cannabis material. Fortunately, Hawaii did not experience what many other states experienced because our rules happened to prohibit the addition of any kind of additives to our cartridges. However, we observed many other states struggle to control that because their rules did not have the ability to restrict the addition of additives. And for some states that had interim rulemaking authority, they were quickly able to respond and change their rules and protect their residents. But other states had to go through a really long process. And in the meantime, those cartridges of concern continued to be sold. So that is one of the reasons why we do feel strongly about maintaining interim rulemaking authority at least for the next few years. And I believe our current authority is through 2025. On the fee structure, we do feel strong. The reason we had requested the changes last year, which we have implemented, was to ensure that the program had the funding that was needed to be sustainable. And the structure that we have implemented does allow us to support the dispensary licensing section, which is the part of the program that's responsible for regulatory oversight. It covers, the fee structure that we have in place currently will cover about 50% of the operating costs. We don't feel that 100% of the cost of that section should be placed solely on the dispensary licensees, because the dispensary system was established for the purpose of serving the patients. And so we do understand that that patient registration fees, in addition, should be part of what supports that section. And so we do believe that those two particular parts of that we have emphasized that we would like to maintain are very critical to keeping the program strong moving forward. I hope that answers your questions.
It does, but in part, I think one of the concerns is that through interim rulemaking processes, there wasn't enough consultation that 91 would typically allow for, and the effect of the licensing fees is now threatening to put out of business the agencies that are actually regulated in our community, and that is a very big concern of mine. So maybe could you speak, so there's that issue. Can I ask you, because you have these kinds of flexibility of rulemaking, are you able to provide some flexibility on the payment of those fees that jumped up exponentially, so that while you have imposed them, is there a way that you can work with the dispensaries to provide some relief? Simply because if we lose, and I'm most concerned with the neighbor islands, I'm most concerned with them. If we lose those regulated entities, then you're saying that that county is going to be completely inundated and just subject to unregulated cannabis. That's not fair to those people. Is there a way for you to provide flexibility?
So understand, one of the things that we have already implemented is so the relicensing fee is due, I believe, on or before May 31st of this year for the coming year. We have already notified all the licensees that at that time, the only fee payment that we are requiring was the expected, anticipated 50,000 annual renewal fee, and with the remainder due to be paid by the end of this year. We are amenable to going back and looking at that and figuring out what might be a reasonable schedule for some of the licensees based on their operations and their financial status. That is something we are completely open to doing.
Okay, thank you for that comment. This raises now the issue because we did, as a policy-making body, decide that we weren't going to general fund you. Can you explain to this committee the status of the patient registry fees and that is now accumulating in a special fund?
So yes, because we were transitioned largely, not completely, to general funds, I believe in 2019, I believe we were transferred. So we do not currently have a ceiling for our special funds, for either special funds. We have requested this in our budget request for this year. However, other than position counts and operating budget, we have not received any feedback yet as to whether our special fund requests have been included. The intent for the special fund moving forward is to cover costs such as consultation for the purpose of implementing changes, rulemaking. We have 6 vacancies currently. That in order to establish those positions, the program has to undertake a reorganization, which is a very lengthy process. So we would like to use special funds to be able to hire a contractor to assist us with moving those things along quickly, and to make and to cover some of the basic operating costs, such as the IT system that we use for the patient registry, the IT system that we use for the dispensary licensing, seed and sale tracking system. Because we are looking at the possibility of opening additional licenses, we would also like to look into acquiring a licensing system, which can be costly, but it will also facilitate not only new licensing, application of new licenses, but it will also greatly support the existing licensees because it will provide an easy mechanism for them to submit their required documentation and reports to the department. So these are some of the activities that we would like to transition to special funds. Another thing that comes to mind is travel and training, especially conference attendance. As I mentioned earlier, cannabis is a new and emerging field, and literally the only way for me to get our staff trained is to send them to scientific and informational conferences on the mainland. And I think that's really, really important moving forward.
Okay. I have another set of questions. Members, I'm dominating this, so please, if you have any questions, just chime in. Okay, on that note, so understanding that the special fund, you folks were taken off of that, and that there is a patient registry special fund. In the conversation around medical cannabis over the course of this session, we as the House have been concerned with this notion that you don't and you do not exercise the authority over collectives and co-ops. We need some language to clarify. From my point of view, the legislative intent has been that this scheme has encompassed all of this from the very beginning, because collectives and co-ops are identified in the law. But can you provide us with some language to clarify that, yes, in fact, there is authority to make your legal team on your side have some reassurance that in fact you folks have enforcement authority over all of medical cannabis and not just the licensed dispensaries?
We would be happy to discuss this with our Deputy Attorney General and to see if there's some language that we can work on to submit to clarify that.
Okay, I'm going to insert some language, and so if you can work with that after the fact, so as this bill continues to move, because medical cannabis and protecting the integrity of the medical cannabis system is very important to everyone in the community. We'll be working on that. Finally, again, another concern that has been raised is, again, and it's connected with patients and where they can grow because of the fact that they can essentially designate someone else to be their caregiver, and there is this growing notion that one facility can provide for 1,000 patients, 500 patients, 100 patients. How have you seen other states regulate around this area?
The most common regulatory scheme that we've seen, well, there's been two. One of them is to completely place grow sites under the regulatory authority of the program. And so that would be one thing, is to explicitly provide that the grow sites, home grow sites or collectives, cooperatives fall under the regulatory authority of the program. The other thing that we have seen is to require registration if you're going to register a grow site, and I think the majority of states that do this, registration is required for, I mean, there's a fee, a registration fee, but the registration fee would only apply to those sites that are not the patient's or the caregiver's residence. So if they designate an alternative site as their grow site, then there is an additional cultivation fee that's required. And along with that, most states also grant the program express enforcement authority to ensure that there's a compliance with plant counts and, and other things such as no manufacturing, and testing requirements and that sort of thing.
Okay, so is that registration fee, cultivation fee, something that is prorated based upon the number of patients that might be affiliated with one particular grow site? Does it increase exponentially? What kind of numbers are we looking at? Are we looking at like a nominal fee? Who pays it? And can you talk a little bit about that?
Sure. The model that I'm most familiar with is State of Oregon. State of Oregon actually charges for every single grow site that is not the patient's residence. The fee, they charge $200 per year. That fee is payable by the owner or operator of the grow site. So it's not paid by the patient. In addition to that, I believe that they do also still have a $200 registration fee for patients, even if it's their residents, the caregivers or residents, but they also have a pretty significant reduced fee allowance. So for patients that are, say, on SNAP benefits or veterans or disability, if they can provide documentation of those special circumstances, there's a significant reduction. I think their grow site registration drops to like $20.
Okay, so let me pause there. The grow site fee in that instance is paid by the patient.
Correct.
And then there's another fee paid by the owner-operator.
For those sites that are not the patient's residents, correct.
And then the payment of the fee for, if it's just the patient, you're saying gets a reduction depending on different criteria.
Correct.
Okay. Anything else you want to add about that kind of area? And then would it make more sense if we imposed a registration fee like that, that would go into the patient fund, the registry fund versus the dispensing fund? and then that would then provide you the authority to work with those, what is basically a patient.
I would say that if it's the fee that's being paid by the patient for their personal home grow site, that should probably be kept with the patient registry section, but the enforcement activities related to a larger site that is not a patient's residence, that would be something that would be undertaken by our dispensary licensing section. So I think it would be more appropriate for the funds to be directed in that direction. One thing I did want to clarify is another request that we do have in our budget is to transition to just one special fund.
Combining them.
Yes, combining it, and so it'll be just a special fund for the Office of Medical Cannabis Control and Regulation, and then we will track revenues and expenditures based on codes internally.
Thank you for raising that, because I don't think that was in your testimony, and I'm going to be looking to
Okay,
my
I'm
vice
sorry.
chair, because she's going to carry the ball on this one further as we continue this. This has been a very productive conversation. Members, any other questions? All right. As it is the practice of this committee, we will recess and take up decision-making at 11:30. We are in recess. The Committee on Health and Homelessness, we are going to reconvene our 8:30 a.m. agenda for decision making. Members, it's going to be a long day, so thank you for all of your hard work. For Senate Bill 64 SD1 relating to Medicare supplement insurance, Chair's recommendation is to defect the date so that it's effective December 31st, 3000. Strike out the severability clause as it is unnecessary. Technical amendments by the HMSO for clarity, style, and then language in here to essentially just allow that that the policy, the Medigap policies can be switched only at the appropriate open enrollment time by as provided by rule of the commissioner. This is a work in progress, members. We want to make sure that this one keeps moving along, and so we're going to continue to work on this. Okay, any comments, questions? Seeing none, Vice Chair for the vote.
Members voting on SB 64 SD1, Chair's recommendations to pass with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi is excused. Representative Mizuno?
Aye.
Representative Nishimoto?
Aye.
Representative Garcia?
Aye.
Chair, recommendations adopted.
Great. Senate Bill 63 SD2, members, this is relating to nurses. This is for the temporary nursing licensure. Good conversation. What my recommendation is to adopt the changes being proposed by the Board of Nursing. Also to reinstate from the Center for Nursing's the graduate permit in section 457-13. Any technical amendments by the HMSO for clarity, consistency, and style. And to defect the date to our standard June 30th, 3000 date for an HD1. Members, any comments or questions? Seeing none, Vice Chair for the vote.
Voting on SB 63 SD2, Chair's recommendations to pass with amendments, noting the excused absence of Representative Kobayashi, who will be noted excused for the rest of the decision-making bills today. Are there any reservations or no's? Seeing none, Chair, recommendations adopted.
Members, for Senate Bill 320, this is a working group for the psychology interjurisdictional compact. Chair's recommendation is to pass out an HD1 to dissolve the committee, the working group by, after submission of the report, to change the effective date to our standard June 30th, 3000 date, noting the concerns of the Board of Psychology and adding members to this working group, including an individual licensed psychologist, a Hawaii Psychological Association delegate, and a member of the Board of Psychology. Also members to the criteria for the issues that are going to be examined by the working group. I will add some of the language from the Board of Psychology, which raises concerns about the practice of remote practice amongst compact practitioners, concerns about insurance coverage, and the reimbursement of liability insurance for compact authorized psychologists, as some of the things that this working group will look at. And then, of course, our defective date, our standard defective date. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 320 SD1, Chair's recommendations passed with amendments. Any reservations or no's?
No vote.
No vote for Rep. Garcia. All others vote aye. Chair, recommendations adopted.
Thank you. For our relating to physical therapy compact, members, we are going to adopt insert sections, appropriate sections for staffing, which will then trigger a finance referral. So it's good that we're hearing this prior to the triple referral deadline. I'm going to insert a delayed implementation date of July 1st, 2025, noting that in the committee report that if this effective defective date is changed, it should provide the division 2 years versus 6 months to implement after enactment. So that would be July 1st, 2025. Going to also insert amendments that would add the appropriate amendments at 461-461 461J-6 and 846-2.7 that would allow for DCCA to conduct the appropriate criminal background checks, and then insert into the language for the immunity to allow for negligence and or gross negligence. That was based upon the conversation we have had in hearing today. Also, any technical amendments identified by HMSO for clarity, consistency, and style. And I believe that is it. Members, questions, comments, or concerns? Seeing none. Vice Chair.
Voting on SB 668, SD2, Chair's recommendations passed with amendments. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Okay, members, Senate Bill 674, Senate Draft 1, relating to interstate medical licensure compact. My recommendation here is to change the language where the board, instead of shall adopt rules, may adopt rules on page 42. Also going to insert the changes for the criminal background checks that authorize them at 846-2.7 and if needed anywhere else in the statutes. Finally, we're going to add into that section regarding immunities, the standard of negligence and or gross negligence. Any technical amendments identified by HMSO for clarity, consistency, and style. And I believe that's it, members. Comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 674, SD1, Chair's recommendations passed with amendments. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Okay, members, Senate Bill 164 relating to loan repayment for healthcare professionals. Chair's recommendation is to insert the latest version of House Bill 661, which was our moving bill, and to ensure that if it's not yet included, to identify the proper entity, National Health Service Courts branch, in the testimony of the University of Hawaii JABSOM, and to continue to push this forward with our new defective date of June 30th, 3000. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 164, SD2, Chair's recommendations passed with amendments. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Members, Senate Bill 599 relating to health. This is with the respiratory therapist. We had some very good conversations. This bill just really codifies its housekeeping. It codifies what is current practice. Chair's recommendation is to add an effective date of upon approval. An effective date of upon approval. Questions, comments, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 599, SD1, Chair's recommendation is passed with amendments. Any reservations or noes?
Reservations.
Reservations for Rep. Garcia. All others voting aye, Chair, recommendations adopted.
Thank you. Members, relating to Pharmacist, Senate Bill 693, Senate Draft 1, Chair's recommendation is to adopt the amendments presented by Kaiser that addresses some of the concerns raised by the Insurance Commissioner, to make sure that we also address the implementation date to give DHS until July 1st, not 2024, but July 1st, 2025 to implement this. I'm also going to note that the committee is well aware of this a requirement that the state auditor conduct a study for this, as this might raise concerns about adding a mandate new services. But what I'd like to do is still pass this bill out, because this will then give the resolution that will have to move for the auditor study a reference point, a very solid reference point about what we might need him to study with this HD1. We'll include any technical amendments identified by HMSO for clarity, style, and consistency, and then a defective date of June 30th, 3000. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 693, SD1, Chair's recommendations passed with amendments. Any reservations or noes?
Reservations.
Reservations for Rep. Garcia. All others vote aye, Chair, recommendations adopted.
Members, Senate Bill 384 relating to access for disabled persons. Chair's recommendation is to pass this with a June 30th, 3000 defective date that is standard for the House. Questions, comments, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 384, SD1, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
Okay, members, Senate Bill 612 relating to service animals. Chair's recommendation is to insert the latest draft with a defective date of June 30th, 3000. That came from House Bill 871. That was House's position, or in this committee's position during the process. Comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 612, SD1, Chair's recommendation is passed with amendments. Any reservations or noes?
No vote.
No vote for Rep. Garcia. All others vote aye. Chair recommendations adopted.
Thank you. Members, we are adjourned on the 8:30. We're reopening the 9:45 a.m. agenda. Let me take up first Senate Bill 1008, which is relating to emergency powers. Oh, shoot, sorry.
1018.
I'm sorry, 1018. I would like to continue to keep moving this along, so Chair's recommendation is to adopt this with a effective date of January 1st, 3000, or June 30th, 3000, and any technical amendments identified by HMSO. Comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 1018, SD1, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair recommendation is adopted.
Okay, Chair's recommendation for Senate Bill 1418 relating to noise pollution is to change at page 3 the hours between 9 p.m. to 6 a.m. to include a defective date of December 31st, 3000. And to continue to move this along for consideration. Chair's comments, members' comments, questions, or concerns? All right, Vice Chair for the vote.
Voting on SB 1418, SD2, Chair's recommendations to pass with amendments. Any reservations or noes?
No vote.
No vote for Rep. Garcia. All others vote aye. Chair recommendations adopted.
Okay, members, moving to Senate Bill 975, Senate Draft 2 relating to health. This is the measure looking to enforce taxing and regulatory scheme over vaping products. Chair's recommendation is going to be to adopt the House position that came out of 537, but to add additional language that would include amendments to sections 245-3 that would essentially place into the excise tax electronic smoking devices, e-liquids, and also to provide a new subsection that would allow an excise tax equal to blank percentage of the wholesale price of each electronic smoking device and e-liquid sold, used, or possessed by a wholesaler or dealer on and after January 1st, 2024, whether or not sold at wholesale or otherwise. Members, the reason for this measure is, as I have indicated, our committee has researched and understands that 20 states have adopted a reduced tax for vape products based on the rationale that it is a harm reduction tool. Another 20 states still have no tax on vape, while another 10 states taxes the same rate as tobacco. We are now in the middle of the pack, and we are losing revenues to address this important issue, and so we need to advance this measure. We're going to basically retain all of the other amendments in the Senate bill that includes, I believe, the repeal, of Chapter 28, Part 12. Members, and then also include any technical amendments by HMSO, as well as a defective date of our standard June 30th, 3000. Members, comments, questions, or concerns? Seeing none. Vice Chair for the vote.
Voting on SB 975, SD2, Chair's recommendations passed with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
All right, members, thank you again for your hard work. Moving to our 10:30 a.m. agenda. I will first take up Senate Bill 465. This is the transportation bill. Chair's recommendation is to adopt the amendments of the Department of Attorney General, add a defective date of June 30th, 3000. Also note that add the amendment, the department shall adopt rules under Chapter 91 for the inter-island transport of controlled substances within the jurisdictional limits of the state, which extend 12 nautical miles from the perimeter of each island and connect Oahu, Maui, Molokai, Lanai, and Kohalave. This is a recommendation from Dr. Clifton Otto, who has long been an advocate on this issue. And then I would like to insert into the committee report that Department of Transportation look and review the policies and airport procedures of the Oakland International Airport as a model for this. A defective date of June 30th, 3000, and any technical amendments identified by HMSO. Members, questions, comments, or concerns? Seeing none, Vice Chair, for the vote.
Voting on SB 465 SD2, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Thank you. Members, relating to Senate Bill 673, Senate Draft 1, relating to medical cannabis. This is related to Ryan's Law. I am going to convert this into a working group with the relevant stakeholders to look at how we can implement this policy, but this is not something that we should do at this moment, as it continues to be something that is still new in the jurisdiction of California. A defective date of June 30th, 3000. Comments, questions, or concerns? Seeing none, Vice Chair, for the vote.
Voting on SB 673 SD1, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair's recommendation is adopted.
Okay, members, moving on to our big bill for making sure that the integrity of the medical cannabis system is strong to protect, first and foremost, the products that are getting into the hands of the community. I am particularly concerned, members, with the proliferation of products that are actually accessible, very, very accessible to our underage students and population in the community because of what I view as some loose regulations. So for Senate Bill 962 relating to medical cannabis, my recommendation is going to be to keep essentially what the Senate has, but integrate that into that a number of provisions. First, members, I'm going to add the waiting room provisions that were in House Bill 1082, House Bill 1082. I am also going to take the amendments from 1217 that state that a primary caregiver shall not use a qualifying patient's cannabis, nor shall the primary caregiver accept a qualifying patient's cannabis as compensation for caregiver services. We are going to include the language about no more than 20 qualifying patients may use any particular location to cultivate cannabis, provided that this limitation shall not apply to qualifying patients who obtain a written exemption from the Department of Health. Further, we will integrate, as requested by some of the testifiers, the fee structure language and the use of color lettering into the section of 329D-11A2. Finally, members, we will also be adding some new language that would collapse the special funds that are subject to the committee into one special fund for the Office of Cannabis and Control. We are going to allow and input the appropriate language that would both allow them to access this special fund as well as expend money from those special funds. We're going to include language for enforcement authority that covers all of the entities that are out there operating under the guise of medical cannabis, which is collectives, co-ops, and the licensed dispensaries. Finally, we're going to create a registration fee for grow sites that apply where the patient is growing on sites that are not their residence, that are not the residences of the caregivers or patients. This is going to mirror some of the language that we already see, the very strong language we see in Oregon, and we are going to impose a fee and allow the department to have rulemaking authority to impose a cultivator fee on the owner-operator of that grow site. At this point, we are not going to impose a fee on the patients, but I will note that that is a policy call that the next committee should look at. And we just don't have enough time at this point in which to look at it. We are going to have any technical amendments by HMSO and our standard defective date of June 30th, 2000. Members, comments, questions, or concerns? Go ahead, Representative Garcia.
Thank you, Chair. Just a quick question. Would your amendments affect the the product Delta 8 products at all?
We have another measure that's moving to address that.
So this bill would, I mean, your
The
your amendments
title,
won't.
no, we would
Okay.
not, this is not something that we could do in this bill because of a title problem.
Got it, okay.
But
Thank you.
certainly something, Representative, that we are, as a committee, every one of us have been very interested in.
Thank you.
Any other comments, questions, or concerns? Seeing none, members, for the vote.
Voting on voting on SB 962, SD1, Chair's recommendations to pass with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, are we done? We are done. Thank you. Until 2, thank you, members.